Borderline personality disorder. What is borderline personality disorder? Borderline personality disorder is a serious psychological condition that's characterized by unstable moods and emotions, relationships, and behavior. It's one of several personality disorders recognized by the American Psychiatric Association. Personality disorders are psychological conditions that begin in adolescence or early adulthood, continue over many years, and when left untreated can cause a great deal of distress. Thankfully, the right treatments targeted for BPD can help significantly. Symptoms. BPD can often interfere with your ability to enjoy life or achieve fulfillment in relationships, work, or school. It's associated with specific and significant problems in interpersonal relationships, self-image, emotions, behaviors, and thinking, including behaviors. BPD is associated with the tendency to engage in risky and impulsive behaviors, such as going on shopping sprees, drinking excessive amounts of alcohol or abusing drugs, engaging in promiscuous or risky sex, or binge eating. Also, people with BPD are more prone to engage in self-harming behaviors such as cutting or burning and attempting suicide. Emotions. Emotional instability is a key figure of BPD. Individuals feel like they're on an emotional roller coaster with quick mood shifts, going from feeling okay to feeling extremely down or blue within a few minutes. Mood changes can last from a few minutes to days and are often intense. Anger, anxiety, and overwhelming emptiness are common as well. Relationships. People with BPD tend to have intense relationships with loved ones characterized by frequent conflicts, arguments, and breakups. BPD is associated with an intense fear of being abandoned by loved ones and attempts to avoid real or imagined abandonment. This usually leads to difficulty trusting others, putting a strain on relationships. Self-image. Individuals with BPD have difficulties related to the stability of their sense of self. They report many ups and downs in how they feel about themselves. One moment they may feel good about themselves, but the next they may feel they are bad or even evil. Stress-related changes in thinking. Under conditions of stress, people with BPD may experience changes in thinking, including paranoid thoughts, for example, thoughts that others may be trying to cause them harm, or dissociation, feeling spaced out, numb, or like they're not really in their body. In order to be diagnosed with BPD, the individual must experience 5 or more of the following symptoms in a variety of contexts: efforts to avoid abandonment, emotional instability, feelings of emptiness, identity disturbances, impulsive behaviors, inappropriate intense anger, unstable interpersonal relationships, suicidal or self-harming behaviors, transient paranoid or dissociative symptoms. Causes. Like most psychological disorders, the exact cause of BPD is not known. However, there is research to suggest that the combination of nature and nurture is at play. 5 types of borderline personality disorder. The first type of BPD is characterized primarily by emotional dysregulation. In simpler terms, this means feeling like you can't control your emotions. If you experience frequent and intense mood swings throughout the day, you might relate most to this type. People with affective BPD struggle most with regulating their emotions when it comes to their interpersonal relationships. When faced with the relational stress, people with this type of BPD are prone to anxiety, depression, and suicidal thoughts. For example, if a person with affective BPD gets into an argument with their significant other, they may immediately think the relationship is over and begin to struggle with suicidal thoughts. Type 2, impulsive. If you've ever struggled with impulsivity due to BPD, you might relate to the second type of BPD, impulsive. Dr. Oldham said that similar to the affective type of BPD, the impulsive type of BPD involves a loss of control. Instead of losing control of your emotions, it's losing control of your behavior. People with impulsive BPD are more prone to struggle with behaviors like self-injury, substance abuse, binge eating, reckless driving, risky sex, and compulsive shopping. Type 3, aggressive. The third type of BPD is connected to the inappropriate or uncontrollable anger symptom of BPD. This anger is called inappropriate because the scale of the anger seems disproportionate to what the circumstance might warrant. Aggressive behavior in the third type of BPD can either be a temperament or a secondary response to trauma, usually from childhood. Type 4, dependent. If you've ever been called clingy in your relationships, absolutely hate being alone, or struggle with knowing who you are outside of others, you might relate to the dependent type of BPD. People with this type of BPD often weren't encouraged to become independent and autonomous growing up, leaving them with overly dependent behaviors in adulthood. These folks may be overly accommodating of others' needs and struggle with setting boundaries. Many people with this type cling to their loved ones because they fear abandonment. In terms of identity struggles, people with this type of BPD may co-opt the personality traits of others. Type 5, empty. Like the dependent type, people with the fifth empty type of BPD often struggle with identity issues. If you live with this type, you might have grown up in a difficult home situation, whether it be due to active abuse, neglect, or invalidation. As a result, you may struggle with trusting others or may feel directionless in terms of setting personal goals. Treatment. Although at one time experts believed that BPD was unlikely to respond to treatment, research has shown that BPD is very treatable. Getting help from a mental health professional is critical because with consistent treatment, you can live a better quality of life with fewer symptoms. Since BPD is associated with risky behavior, self-harm, and suicide, treatment can also help curb these behaviors. Find someone who specializes in BPD because you will need the treatment that are targeted specifically to BPD. If you aren't getting the right treatment, it may not be as effective. The usual order of treatment options includes psychotherapy. This is the standard treatment for BPD. Examples of psychotherapy that are targeted to BPD include dialectical behavior therapy and mentalization-based treatment. This may include your family, friends, or caregivers. Medication. Your mental health professional may also recommend medication to help treat certain symptoms such as depression or mood swings. Other treatments. Hospitalization or more intensive treatments may be necessary in times of crisis.